Good morning. This is Miami Valley View, a public affairs program brought to you by iHeart Media Dayton. I'm your host, Dave Alexander, and this morning we are talking back to school, but not what you might think. Joining me this morning is Dr. Becky Thomas, the Medical Director of Public Health, Dayton and Montgomery County. So, Dr. Becky, good morning. Thanks for being here.
Good morning. Thank you so much for having me, Dave.
So we're talking back to school, but we're not talking back to school sales. We're not talking, the tax break that we got going on here in the state of Ohio. We're talking about the importance of back to school vaccinations.
Yes, absolutely. Those things you mentioned are the things that come to parents' minds first. A lot of times when we talk about back to school, it's time to get a haircut. It's time to go and get all the things on the
new shoes
school
and
supply list. Yeah, do the clothes from last year still fit?
Right.
But we want people to remember that you also need to be thinking about vaccines so that kids can get off to a healthy start to the school year and be set up for success.
So why is it so important for these back to school vaccinations?
School is a place where kids
a
are...
Petri dish.
Yes, absolutely.
It is. Yeah.
Right? Kids are together in the lunchroom.
Right.
They're together in art class, gym class. They're in very close quarters. And we know that kids bring a lot of germs with them, and those germs can spread easily in those kind of quarters.
Okay, so are there certain vaccinations that are required for children as they go back to school?
Yes, absolutely. Kids going back to school, especially at certain grade levels, need to have certain booster doses documented in order to attend school. So in the state of Ohio, those vaccines for kindergarten are the DTP vaccine, which protects against tetanus. Most people have heard of tetanus. Sure. Diphtheria, which is a respiratory disease, and pertussis, which is whooping cough. MMR, which protects against measles, mumps, rubella, hepatitis B, which is a liver disease, polio, and chickenpox.
Wow, interesting. And for higher grades, does that change?
Yes, going into 7th grade, kids need boosters against, again, the tetanus, pertussis.
So they're getting boosted for...
And meningitis.
Yeah, so that's funny. So it's not funny, but... my daughter is about to be a senior at Bishop Fenwick High School, and we got an email that says, your daughter, and she has, but needs, a meningitis vaccination to begin her senior year at Bishop Fenwick. I was like, oh, well, there's the email. So, yeah, there are certain required vaccinations for students.
Yes, and 12th grade is the other grade. So kindergarten, 7th grade, 12th grade.
Okay.
And then any students who have transferred schools and are starting in a new school system will also be required to bring vaccination records to be enrolled.
So just real quick before we get into more information, but is there like a website that we can go to as public health website to go check out that list that you just gave us?
Yes, we have a list on our website, vaccinesprotectkids.org, that lists out all those vaccines that you need.
That little list for you. So we started with kindergarten. So that's the age that kids should start receiving routine vaccinations, or should it be earlier?
Kids actually start receiving routine vaccinations right when they're born. So before they leave their hospital, they've actually receive one or sometimes two vaccines.
Okay.
Vaccines are timed out so that they're given at the time that they protect kids the most from the diseases that they'll encounter and that they're most at risk for at a certain time. So you can kind of think of it like when you go to an amusement park and there's a measuring guide about,
You're this tall to ride this ride.
Are you big enough to ride this ride? Yeah. So, like that, it's been studied and well studied when these vaccines should be given, when your immune system is developed enough to be able to respond to them and develop the protection that you need moving forward, and when you need to have those boosters in order to provide long-lasting protection.
Awesome. So started when they're born. We also have, and if you're going into school, kindergarten, 7th grade, and 12th grade, senior year in high school are the three big ones for going back into school. And plus, if you're transferring, you got to have all you got to have all your records, your vaccination records possible. So one of the questions that, of course, these days is about the safety and effectiveness of vaccinations. So how do we know that vaccinations are safe for children?
That's a great question, and a question that we get asked a lot recently as vaccines are more in the news. We know that the routine childhood vaccinations that we've just been talking about have been studied over decades. They really have been used for decades now, and we have all kinds of good, real, actual experience.
I remember getting vaccinations when I was a child. You know, that you got chicken pox vaccination and all that, or not chicken pox, because I actually got chicken pox. I did get the shingles vaccination, though. By the way, that hurts a lot. I don't know if everybody's got a shingles vaccination, but holy cow. So it's decades of information that has proven that these vaccinations are very safe, are very effective.
Right. Of course, all science starts with laboratory research and studies, involving first animals and then humans. But these vaccines that we're talking about today have, in addition, had those decades of real life experience to show that they're both safe and effective.
Absolutely. Are there any side effects maybe parents should be looking for, like after they receive that vaccination?
Most of the time, the side effects are very mild. Kids may be slightly irritable. The spot where the child has gotten vaccines, little red, little tender and sore, but nothing major and significant, and nothing at all compared to actually getting the infection.
That's going back to the shingles vaccination here as a 50 plus adult, and the doc's like, it might hurt your arm for a little bit, but it's much better than what would be if you actually got shingles. So what should parents do? Let's say they're a little concerned about the vaccination, about the safety of it, or maybe the ingredients inside said vaccination. Is it, once again, go to your website? Is there a number we can call? What's the deal with that?
The very best thing that I recommend is that parents have a doctor for their child that they know and they trust, and they can take their questions and concerns to. That's the very best place to go. And if you can get your vaccines at your doctor's office, that's terrific. Some people don't have a doctor, or they may not be able to get into their doctor for some time. This is a very busy time with trying to get sports physicals in and things like that. So there are options for children to get vaccines at other places. And one of those places is our immunization clinic at our health department downtown at the Rybold building. So people can call 937-225-4550 and make an appointment at our vaccine clinic. We have these routine vaccines needed for school and for healthy childhood, and also travel vaccines too. So
we're speaking of the possibility that maybe this family doesn't have a primary care doctor, or maybe underserved communities. What are we doing to ensure that all children are getting their vaccinations?
We absolutely want to make sure that all children and all families have access to vaccines. So because of that, the federal government provides a program called Vaccines for Children, which does supply vaccines to about half of all children in the United States.
Wow.
Yeah, half of all children.
Holy cow.
Yeah.
That's a major number.
So it's really important that parents are aware of this program.
Right.
You don't have to sign up or register or anything like that. You just go and get these vaccines at a participating vaccine for children provider.
Wow.
And that's for kids who are on Medicaid, kids who don't have insurance at all, kids who maybe are eligible for Medicaid but haven't been enrolled, kids who have insurance but their insurance doesn't cover vaccines, and then also a few other categories. But it really covers a lot of people.
That's a lot. And that's great that, we are promoting the need for these back to school vaccinations, and then backing it up by saying, hey, we have it. If you don't have insurance or a primary care doctor, or you haven't signed up for Medicaid, whatever the case may be, you can still get them and get them for free.
Yes. And one other thing that we hear sometimes is that there may be a language barrier with getting vaccines too. And so we'd like people to know that we do have translation services alongside those vaccination services at the health department too.
You guys are covering everything. That's great. All right. So another question a lot of people are going to be asking, because it looks like it reared its ugly head again over the summer, is COVID-19. Is it still recommended to get a COVID-19 vaccination for children as they go back to school?
That's a great question, and those recommendations have been changing.
Okay.
What we know is that COVID, even though the numbers are increasing slightly now, is still at very low levels in our community.
Yeah.
It's not a vaccine that's required for back to school, but we'll be watching the guidance on that moving forward.
That's smart. That's great. And you figure everybody's outside, more people are together. It can happen. It can spread. Which brings me to flu. The flu vaccine always recommended. Is that right?
That is correct.
Okay.
The flu vaccine is always recommended. Last year we had the highest number of kids with flu vaccine or with actual flu infections because of low vaccination rates for flu that we've had in several years. And we had a large number of children nationwide, I think 200 plus children who actually died from the flu.
Heavens.
So it can have very serious implications.
Yeah. Get your flu vaccine.
Yes.
Absolutely. I get mine every year.
Everyone 6 months and older should be getting a flu vaccine.
And when can you start getting that? Can you get that right now?
It's recommended usually in September or October.
Okay.
And because you only need one dose and you want that dose to last throughout the time when
the
flu is
season.
typically spreading in the winter. Now, kids who are younger than 8 years of age and have never had a flu vaccine before need to get 2 doses that first time, a month apart. So it's important to get on that a little bit earlier.
Schedule it, make sure you remember
if
the
it's their first dose.
Got it. And that's younger than 8.
Correct.
Okay. So the next question is, when somebody's coming in for vaccinations, if you're a parent, can your child get more than one at a time?
Definitely.
Yeah. Okay, good. I think that's the answer everybody wants to hear. I don't know if the child wants to hear that, but parents are like, I don't have to make multiple trips to get vaccinations.
Well, the good news is that a lot of vaccines come in combination now. So it's actually fewer pokes. There are some vaccines that, like the MMR, already are built in to protect against measles, mumps, and rubella. So kind of a 3-in-1. But then there are vaccines where that is actually combined with a couple other things that protect against other diseases. So you can really minimize the number of pokes that your child is getting.
Minimize the pokes. That's always good. What are some of the common myths or maybe misconceptions about vaccines?
Well, we've kind of just rolled off talking about one of them, which is that can you get multiple vaccines at a time, or is that going to be too much to overwhelm my child's immune system? And the answer is absolutely. There is no problem with getting multiple vaccines at the same time. In fact, it's recommended, and those are studied in that way to make sure that it's safe and effective for them to be given together.
Good.
Another thing that's in the news a lot recently is thimerosal, which is a preservative that's found in vaccines and contains mercury.
Okay.
So there's been some discussion about should we be concerned about that, and the answer is no, absolutely not. It's, again, been in vaccines since the 1930s.
Oh, wow.
And has been proven to be very safe.
Right.
Having said that, it is not present in all routine childhood vaccines up through the age of 6. None of them have thimerosal in it at all.
Okay.
It is found in some multi-dose vials of flu vaccine that are given, but it's only in very limited vaccines, and every vaccine has an alternative without that particular preservative.
Oh, I didn't know that.
If people are concerned.
Oh, that's great. See, good news there. All right, before I let you go, I want to give one more question. Since we are talking about getting the back-to-school vaccinations, what kind of role do teachers and schools themselves have in promoting vaccination?
That's a great question. We are very interested in working with schools. We have worked with our Montgomery County Educational Service Center to have these conversations with our superintendents and with school nurses because they're really trusted leaders in their schools in this area and have a lot of interactions with the families and can also be kind of pivotal in debunking misconceptions and following through and making sure that these vaccinations happen in a timely way.
That's great. I mean, let's get them to help. There a lot of stuff. Let's promote this. Get your vaccinations. You're back to school. 'Cause, I mean, let's face it, it's for some less than 2 weeks away. The start of school is, believe it or not. My daughter's kind of regretting it. She's like, I'm like, it's your senior year. Enjoy it. So, but Dr. Becky Thomas, thanks so much for joining us this morning. You have been very informative. Go check out their website. Is it phdmc.org?
Correct.
A lot of great information there about getting your back to school vaccinations. Once again, Dr. Becky Thomas, thanks so much for joining us.
Thank you, Dave.